All right, welcome. Today, we're going to talk about something called brachytherapy. It's a really powerful and honestly, a super precise way to treat cancer by fighting it from the inside out. We're going to break down exactly what that means and how it all works. So, here's how we're going to break it all down. First, we'll get into that big idea, what fighting cancer from within actually means. Then, we'll check out the two main ways it's done, see which cancers it's used for, and then wrap things up by covering the key benefits and, of course, answering the questions that are probably already popping into your head. Okay, first things first, let's get to the core idea. When most of us think of radiation, we picture these big machines with beams coming from the outside. What makes brachytherapy so different and so effective is that it completely flips that idea on its head. It's all about location, location, location. Yeah, so we're not talking about beams trying to hit a target from across the room. Brachytherapy works by putting a tiny, powerful radiation source right inside the tumor, or literally right next to it. It's this incredible closeness that gives it all its power. And this is where it gets really interesting, right? Think of regular radiation as a flashlight beam in a foggy room. It has to pass through a lot of stuff, your healthy tissue, just to get to the tumor. Brachytherapy avoids all of that. By putting the source right at the tumor, you can deliver a really high concentrated dose exactly where you need it, which helps spare all the healthy organs and tissues around it. Okay, so the big question is, how do you actually get that radiation source inside the body? Well, it turns out there's more than one way to do it. The treatment is really tailored to the specific cancer, which has led to two main approaches, and they're actually quite different from each other. These two paths are called high dose rate, or HDR, and low dose rate, or LDR. You can kind of think of HDR as a quick, powerful visit. The radiation source goes in for just a few minutes, does its job, and then it's taken right back out. LDR, on the other hand, is more of a slow and steady kind of deal, using these tiny implanted seeds that deliver their radiation over a much longer time. So for that HDR path, it's a really controlled process. First, these little tubes called applicators are put in place. Then a tiny source travels into them for just a few minutes. It delivers the dose, and then it's pulled all the way back out. Simple as that. You walk out of the clinic and there's no radiation left in your body at all. Now, the LDR approach, that's a whole different ballgame. In this case, tiny radioactive seeds, and they're literally about the size of a grain of rice, are permanently implanted. They slowly release their radiation over several weeks or months, and then they just become inert. So it's a one-and-done procedure with a long, continuous effect. All right, so we've covered the how. Now let's talk about the where. What kinds of cancer is this super precise approach most effective for? When it comes to gynecologic cancers, brachytherapy is a real cornerstone of treatment. For endometrial cancer, it's fantastic for lowering the chances of the cancer coming back. And for cervical cancer, look, this isn't just a nice to have. We're talking about something that's often considered essential for a cure. For prostate cancer, both HDR and LDR are amazing tools. They give patients excellent long-term cure rates, right up there with surgery. But here's the kicker. They do this while having a much lower risk of damaging nearby organs, like the bladder and rectum, which is a huge deal for quality of life. And it's not just for cancers deep inside the body. This is a game changer for skin cancers, especially when they're in really visible, sensitive places, on your nose, your ear, or your lip. It offers a non-surgical way to treat the cancer while doing a fantastic job of preserving your appearance. So, with all this talk about precision, you're probably thinking, what's the real advantage here? Let's pull all that together and look at the key benefits, and also what you can generally expect if you go through this. When you really boil it all down, the advantage is crystal clear. You're hitting the cancer with a very high, very localized dose of radiation. This often means you need fewer treatment sessions than with external radiation. And, as we've seen, it's all about sparing your healthy organs, and in many cases, avoiding major surgery altogether. Okay, let's talk about side effects because, of course, that's a concern. The good news is, because the radiation is so targeted, the side effects usually are too. They're typically temporary and really confined to the specific area being treated, and your medical team will have a whole plan to help you manage them. All right, let's move into the final stretch here and tackle some of the biggest questions people have when they first hear about this kind of treatment. And here it is, probably the number one question on your mind. Will I be radioactive? It's a fair question, and the answer really just depends on which type of brachytherapy we're talking about. For high-dose rate, or HDR, the answer is a big, simple no. The radiation source is temporary. You walk out of the clinic and it's gone. You are perfectly safe to be around anyone, kids, pregnant women, anyone, right away. Now, with the low-dose rate seeds, you are minimally radioactive for a little while, and your team will give you a few very simple precautions to follow for a short time. Another big one, and totally understandable, is, does it hurt? What's it actually going to feel like? Look, your comfort is absolutely the top priority. Any potential discomfort from getting the applicators or seeds in place is really well managed with anesthesia or numbing medication. And here's the most important part. During the actual radiation delivery itself, you feel absolutely nothing. And the recovery? The great news is it's usually super quick. Most people find they're able to get back to their normal activities in their daily lives within just a few days. You know, there's a quote that I think just perfectly sums this whole thing up. It says that brachytherapy is one of the most precise forms of radiation therapy, delivering a high dose exactly where it's needed. And really, that's the whole philosophy in a nutshell. Maximum impact on the cancer, minimum impact on you. So, at the end of the day, brachytherapy is it's a remarkable tool in modern cancer care. It's targeted, it's efficient, and it's focused on preserving your quality of life. And really, the biggest question is one to discuss with your healthcare team. Could this precision approach be the right one for your plan?